With information about different diseases and ailments emerging recently, we still have many that baffle the medical minds every day as we battle to contain and inform the general population. Fibroids is one ailment that have had many medical minds and the minds of women, especially African American, in a frenzy for years. Fibroids are unnatural growths that form in or on the uterus of women. These tumors can occasionally grow extremely large, resulting in excruciating stomach pain and irregular periods. Other times, they have no noticeable effects at all. Usually benign or non-cancerous are the growths. There is no known cause of fibroids. If you are new to the channel, please like, comment, subscribe for more information on women's health. So, what is a uterine fibroid embolization? Just how effective is this procedure? This method can be used in place of major surgery to reduce recovery time and hospital stays. By cutting off the fibroid tumors' blood supply, this treatment causes them to shrink. During UFE, a catheter is placed into a blood vessel in the wrist or leg and directed to the blood vessels feeding the uterine fibroids using fluoroscopic X-ray imaging. To stop the flow of blood to the fibroids, tiny particles are injected. Once the fibroids' blood supply has been cut off, patients can go home while the fibroids gradually get smaller over the coming weeks and months. With an estimated success rate of 85%, uterine fibroid embolization is a fairly successful operation. The majority of patients who have the procedure have a significant improvement in their symptoms and a reduction in the size of their uterine fibroids. After UFE, menstruation that has been heavy will typically resume its more regular flow. After embolization, fibroids starve and shrink in a fashion similar to how they naturally do after menopause. With no need for surgery, fibroid embolization is a minimally invasive treatment that shortens hospital stays and recovery periods. Any woman experiencing symptoms from her fibroids and who wants to avoid surgery, such as a hysterectomy, is typically advised to undergo UFE. UFE, in contrast to some other fibroid therapies, targets all uterine fibroids and is beneficial for both people with a few and those with many fibroids, regardless of the size of the fibroids. Adenomyosis, a less prevalent cause of prolonged and painful cycles, can also be treated with uterine embolization. Fibroid-related infertility can be challenging, and UFE may not be the best course of treatment for those who want to become pregnant in the future, yet have fibroids. Additionally, patients who have fibroids in specific uterine regions can be better candidates for another form of therapy, such as surgical fibroid excision. You and your interventional radiologist will talk about whether UFE is an effective course of treatment. So, what should you expect following? After the operation, there are no restrictions. Recovery following embolization normally takes a week to 10 days. Pelvic pressure and pain following the procedure might be severe in the initial days. Similar to how you might feel when you have the flu or a cold, you might have chills, fever, and decreased energy. Strong painkillers and anti-nausea medications for use at home will be prescribed to you. Many patients go home the same day as the treatment. However, some may prefer to rest in the hospital overnight to get intravenous pain medication to assist and manage their pain. If you are still tuned in, please like, comment, subscribe so we can grow together and provide you the best content for your body. Following the treatment, the first cycle is frequently heavier and more painful than usual. In the first few weeks, breakthrough bleeding between menstrual cycles is typical. The benefits of the procedure are often not felt for 3 months, and the fibroids frequently continue to decrease for 6 to 9 months or longer after the procedure. As stated in the beginning, about 85% of patients who have uterine artery embolization see a major improvement in their symptoms, whereas the remaining 5 to 10% may need to repeat embolization or other operations to do so. The majority of problems are infrequent and treatable. Risks include the evacuation of fibroid and uterine damage, or infection necessitating surgical removal. Before considering treatment, your interventional radiologist should be fully informed of these risks, which are all less than 1% in each case. After UFE, your menstruation can completely stop if you are approaching to menopause. Although this procedure is made available, there is still no guaranteed cure for this ailment at the end of the day. Doctors are constantly fighting for a cure to ensure this issue is being properly dealt with, so nothing else will come from it. Till then, we can only inform anybody who suffers from fibroids of the possible relief and remedies that may or may not work. Thank you so much for watching.